Okay, think about this for a second. The human body is this unbelievably complex machine, right? So what happens when a critical part gets lost? Maybe to cancer or some kind of major accident? Well, surgeons can't just order a replacement piece. They have to rebuild it. Today, we're diving into the body's very own spare parts kit, a pretty incredible technique that has totally changed the game for reconstructive surgery. And that's the million-dollar question, isn't it? You're not just closing a wound. You're rebuilding a life. You're trying to restore not just how something looks, but how it works. I mean, how do you replace something as complicated as a piece of your tongue or recover an exposed bone to save a leg? The answer is, well, it's really elegant, surprisingly resourceful, and it's been hiding in plain sight this whole time. All right, so let's get into the weeds a little bit. What is the actual challenge we're talking about? To really get why the solution is so brilliant, you first have to understand the huge void, literally and figuratively, that surgeons are trying to fill. See, you can't just use some synthetic material to patch a person up. The body's just going to reject it. No, what surgeons need is a living, breathing patch, something that has its own blood supply, that can fully plug into its new home, heal, and become a permanent part of the body. It has to be alive. So where on earth do they find this amazing, living material? Well, they get it from the patient themselves. And in the world of reconstruction, there's one source that stands head and shoulders above the rest. It is time to meet the workhorse of modern surgery. Now, the key idea here is what's called a surgical flap. And let me be clear, this is not a skin graft. A flap is a whole chunk of living tissue. We're talking skin, fat, sometimes even muscle, that gets moved with its own artery and vein, its own little power cord still attached. This lifeline is what lets it be plugged into a new spot and just keep on living. And the undisputed champion of all the flaps? That's the anterolateral thigh flap, or the ALT flap for short. It's a piece of tissue taken from your upper outer thigh. Its reliability and just how adaptable it is are so legendary that surgeons all over the world just call it the workhorse. It's basically the Swiss Army knife in their surgical toolkit. But, like any tool, it's got its pros and cons. The pro column is pretty amazing. That long vessel leash means surgeons have a lot of wiggle room to connect it. The blood supply is super reliable, and the spot they take it from on the leg, it heals up really well. But it's not perfect. On the con side, the skin color might not be a perfect match for the face, and, yep, it can sometimes grow hair in a place you really wouldn't want it to. So, how do surgeons actually find and safely harvest this incredible piece of living tissue? It's not just guesswork. It's a really precise surgical blueprint, almost like a kind of anatomical treasure map. This part is just beautiful, seriously. Surgeons draw a line from the bony point of your hip down to the top of your kneecap. Then they find the exact midpoint of that line. And right there, inside a tiny 3-centimeter circle, that's where the little blood vessels that feed the flap are. They use a handheld Doppler to literally listen for the pulse of these vessels, pinpointing their exact location before they ever make a cut. It's incredible. And all that precision leads to some amazing results. In the hands of a skilled surgical team, the success rate for moving this living tissue and having it survive in its new home is over 95%. That's just staggering. It's a huge testament to how reliable this whole technique is. That reliability is one thing, but it's really only half the story. The true genius of the ALT flap is how unbelievably versatile it is. I'm not kidding, it is, quite literally, a flap for everything. The best way to think about it is like a customizable kit of parts. The surgeon gets to pick and choose which ingredients to take based on the exact problem they're trying to solve. Do you just need a thin layer for coverage? Okay, take the skin. Need to fill a deep hole? Add some fat. Need something with structural strength? You can include this tough layer called fascia. You can even include a nerve to bring back feeling. It's completely bespoke reconstruction. So let's look at a real-world example from the source material. A patient loses part of their tongue to cancer. Now, that's just devastating, right? It affects your ability to speak, to swallow. I mean, these are fundamental things. The challenge is, how do you rebuild something that's so delicate, so mobile, and needs to have sensation? And this is where that customization we talked about is so crucial. The surgeons harvested a very thin ALT flap, but, and this is the key, they made sure to include a sensory nerve. This means the new tissue isn't just a lifeless patch, it becomes a living, feeling, functional part of the tongue, and that's what allows the patient to get those critical functions back. Now, let's switch gears to a completely different problem, a severe leg injury. An open fracture, where the bone and the metal plates holding it all together are just exposed to the air. This is a surgical emergency, with a super high risk of a deep infection that could cost someone their limb. So here, the surgeons needed to solve two problems at once. They had to fill that deep space around the bone, and they had to cover the whole thing with durable skin. So they took a composite flap. They used a piece of muscle to pack the defect, which also brings in a ton of blood supply to fight infection, and then they draped the skin and fat right over the top. Two birds, one stone. And it doesn't stop there. I mean, look at this list. The ALT flap is used all over the body, rebuilding parts of the face, the throat, strengthening the abdominal wall after major surgeries, even creating new breasts after a mastectomy. It has absolutely earned that workhorse title. But what happens in those rare cases where the anatomy just doesn't cooperate? When the surgeon's main plan just isn't going to work. Well, it turns out the body has this really clever backup plan basically built right in. So remember we said that in about 2% of people, those critical little blood vessels are either missing or they're just too tiny to use safely? Imagine being the surgeon, discovering that in the middle of an operation. The patient's asleep, the defect is there waiting to be fixed, so what do you do then? And this is where it gets really, really cool. The body has this fascinating little anatomical quirk. See, the blood supply to our workhorse ALT flap has an inverse relationship with its neighbor, the anteromedial thigh, or AMT flap. Just look at the chart. In patient B, when the vessels for the ALT are rare, the vessels for the AMT are abundant. It's like a seesaw. So, what does this mean? It means if the surgeon can't find the vessels they need for the ALT flap, they don't have to panic. They can just extend their incision a little bit, shift their focus, and harvest the anteromedial fly flap instead. It's an amazing built-in plan B that's literally right next door. And all of this, its incredible versatility, its reliability, and even its built-in backup plan is summed up perfectly here. These advantages allow the anterolateral thigh flap to be considered by some reconstructive surgeons as an ideal soft tissue flap. It really says it all. So what this all boils down to is that surgeons now have this amazing biological spare parts kit. They can harvest living, customizable tissue and move it almost anywhere in the body to rebuild whatever was lost. And that just leaves us with one final kind of awe-inspiring question to think about. With a tool this powerful, what are the true limits of what we can reconstruct?